COVID is becoming a growing problem in Colorado, and today the governor said it's time for an intervention as far as COVID-19. Of course, the holidays are approaching, so you may need to change any plans to prioritize your safety and the safety of your family and your loved ones. Our 9 Health expert, Dr. Payal Kohli, has some insight as always. So, Dr. Kohli, a few weeks ago, public health experts were saying if we limit the number of people who gather to a small number, then it's reasonably safe. So small gatherings are more risky now?
Yeah, Tom, they are, and it's really unfortunate that I have to say this so close to the holidays, but what's changed is the number of cases in our community. So as the number of cases in the community increases, the likelihood that somebody who's asymptomatic is going to be carrying the virus and spreading it and come to your small gathering also increases. What we're also learning about these small gatherings, Tom, and why there's such a big driver of spread is because we really tend to let our guard down in the small gatherings. We're just getting together with one other person or another couple or another family. We tend to not wear masks, not socially distance. Maybe we don't be as mindful of what we're touching or how many times we're touching our face. And that's part of what's driving the spread. And then the final piece of this is that small gatherings, people who end up going to small gatherings do it weekend after weekend. So if I go to a small gathering this weekend with 2 other people and then do it next weekend with 2 different people, I've essentially had a gathering now with 4 people, and same for them. So what we're seeing is that the number of exposures are exponentially growing because people have the misconception that they're only meeting with a few other people, but those other people are then also meeting with several other people.
Yeah, and these events are about time. That time you spend with people, and spend too much time with people, you're obviously upping the risk. So experts have talked about using testing to maybe make gatherings safer. Well, what can testing do, and what are the limitations?
Yeah, I'm really glad that you brought this up because testing is a way to make gatherings safer. It's what I've been saying all along, that testing is one of those 3 T's that's critically important. So testing is great, but it's not foolproof. And the CDC actually just published this case to demonstrate that. So shown on the left-hand side, the large red figure is a teenager who tested negative for COVID-19, then went to a gathering with 14 relatives in this house that they all shared this large house together, and ended up infecting 11 out of 14 of those people, and she herself was infected. So 12 out of 14 people, because they were all in close contact. They were not wearing masks, not socially distancing. If you look on the right-hand side, that same person was also exposed to 6 relatives who were staying outside the house, and thankfully none of those individuals actually tested positive. So it really does emphasize a few things. The first is that testing has its limitations. So if I get on a plane and the minute I get off the plane I do a rapid antigen test and that comes out negative, that doesn't mean that I wasn't exposed to the virus on the plane, because the virus needs a few days to build up in my bloodstream. So that is not how we should be using testing as a way to give ourselves a pass to not wear masks and not socially distance. The second thing that this case illustrates really is that with masks and social distancing, even somebody who's positive, can have contacts that don't get infected if those measures are in place. So what I would recommend for the holidays is that we do use testing as a way to make our gatherings safer, but we're mindful of the fact that up to 16% of those rapid tests can be negative, and that it sometimes takes people a few days to turn positive after their exposures.
So just because testing is available, you're not advising that people plan get-togethers?
That's exactly right. So you can't say that, oh, we all tested negative, so now we can have a get-together with no precautions. So testing is a way to make get-togethers a little safer, but they're definitely not a pass for you to plan get-togethers. Now, if you really want to use testing and you really want to have a get-together, then what you need to do is, wait 4 or 5 days after your plane trip, then get tested, not with the rapid test, but the PCR test that takes a couple of days. And then if that's negative, you still want to be employing those physical distancing measures and those masks. And that is really the safest way for us to see our friends and family this year.
Well, it's not great news, but it's great advice as always. Thanks, Dr. Kohli.